Yeah, well, I mean, I don't recall ever looking after anyone with sickle cell disease that I knew of or that I can remember before I actually started working at the Children's Hospital, and that was 11 years ago. But before that, I'd been nursing for a few years before that as well, and that was with adults, and I don't ever remember meeting any patients with sickle cell disease in my adult nursing career. So it wasn't until I started working in the day medical unit at the Children's Hospital that I first met a patient with sickle cell disease. So I think, whether that's because there's becoming more patients in Australia, but also in the adult setting, I wasn't in the haematology sort of area, so didn't ever care for anyone, but I don't remember learning a lot about it in our training either. So it's definitely something that is more recent in terms of my career. Yes, I suppose working in this dedicated sickle cell nurse role, it's allowed me to learn so much more about sickle cell disease. And then forming relationships with our patients and their families is a really important part of that care. And I think seeing our patients in the different settings, so whether that's coming into outpatient clinic, whether they're in the day medical unit for chronic transfusion or red cell exchange, and also the patients who come into hospital and are unwell and get admitted, and it helps to form this overall picture of the sickle cell patient experience. And I think that's really beneficial for a caregiver, because you can see that it's not just, what we see once a month in day medical or in outpatients. There's a whole other side of it, and when things are really bad, that's when you can learn a lot as well about the different complications and what makes things better for our patients and families. And that might not just be the medical care that they come in, but what we can do sort of from a social side as well. And just I think having caregivers at the hospital that do understand about their disease makes them feel a lot happier and safer, and as though someone understands their disease really well, which I think, judging from my early experience of nursing, certainly not a lot of caregivers do have that good experience and knowledge of sickle cell.
You guys, I know a lot of you, some of you are caregivers, parents to people who are living with sickle cell disease, and some of you are also people who are actually living with sickle cell disease. So with that, I will throw my first question to Mwewa. Just tell me, what did you understand about living with sickle cell disease? When was the first time you were actually exposed to it?
Thanks, Natalie. Looking back, I remember my late half brother had sickle cell on my dad's side, and we saw him when he would go through his crises and the like. It was very much, rest. Take folic acid was all that they would take at the time, and really he would have extended periods of hospital visitations and admissions as well. So it was very much a folic acid type. When he has an event, then he would take some painkillers, and that was all I knew about sickle cell until when I had my daughters. I kind of thought that was the way it was going to be. But yeah, it was a different thing. So that was my introduction, I guess, to sickle cell.
Yeah. Okay. Thanks, Mwewa. And with that, I'll probably throw this question to you. When did you first understand that, you had sickle cell disease?
Well, I think it was around prep. My mum explained to me what it meant. And I've always just known that I was a bit different. So I had to drink more water than others and visit the hospital more than others. And if I were to explain it to someone, they wouldn't understand. And I didn't even understand that much before. And I've just learnt more about it the more I've grown. And even this year, I've learnt more after telling my class about it and doing a bit more research.
Okay. Yes, I do understand that you put together a presentation for your friends. We do hope to, to have you within our group so that you can share it even more widely. Back to Mwewa. Mwewa, can you tell me what you hope this conference can help achieve for people living with sickle cell disease? Given that it is our very first conference, not just for ASCA, but even Australia-wide.
A great question, Nat. Actually, my hope as an advocate and as a parent is firstly, as an advocate, I think that space just to raise the profile, raise a lot of awareness of the disease, its management, and all these other intricacies, because as we're learning, it's a very multi-system condition. So how can those areas that impact persons living with sickle cell, how can that be made part of our normal living, like we have people who have asthma and the protocols in place and everything that needs to happen. So that's one thing I'm hoping to see that. As a parent, I would like to be empowered with a bit more information. What can I do? How can I help? How can I help the children? How can I help my children? How can I help those in my community who have it to navigate through this space? What do I hope to do? But then also for the persons living with sickle cell, my hope is that they're also empowered. They know there's a community. They know that there's people that they can talk to. They're empowered with information, which will in turn help them also to know how to advocate for themselves, particularly when they're representing in the hospitals and all these other spaces in school, at work, what sort of information they can share, what sort of things they can do themselves. That would be an empowering place. So that is really my hope.
Okay, I really hope that can. This is why we have this conference today. And I will also throw this question to young Hannah. I would like to hear your perspective. Especially as a young patient. I know that you do rely a lot on mom to get you through all the hospital system. But one day I know that there are some things that you would like to see as well. So what do you hope this conference can help achieve for people living with sickle cell disease?
Well, I'm hoping that more people can get a better understanding of it, because there are people who just don't understand it as much, and that can cause problems. And I'm hoping that there'll be more activities that they do on sickle where they can teach the students a bit more about what other kids are going through. And how they can help support them. And signs of stroke as well. Just teaching them the signs of stroke, I think, is really important.
That is a really great point.
Just the thing to do in emergencies.
My first question to you would be, do you think enough attention is paid to the mental health and well-being of people living with sickle cell disease in the clinical setting? So aside from the focus on treatment of symptoms and management of the condition, would like to hear your insight. Maybe Mwewa, would you like to answer that one?
I guess, and that's another great question, Natalie. Actually, I'm experiencing the sickle cell journey through my children. So it's very much, and that's where I'm coming from, is from that perspective of walking that journey with them. And I can't say I understand fully. I would be lying if I said I did. I don't fully understand. So I think it's from their perspective of having to, and my daughters are teenagers now. So it's just navigating that space. So to be honest, I know I had talked about it, and again, I'll use the experience of my children. When I had mentioned to the doctor, the hematologist, about my younger one, just having some questions, and that came about by conversations I had with them. She quickly, responded and arranged sessions for my youngest to have a session with. So I think it's to answer your question, it feels like it's a two-way street. Firstly, as a patient, as a carer, are you aware that there is that issue? Do you know what I mean? Are you aware that it's there? And if you are aware, then what do you do about it? Talk about it. And my response to that would be talk about it with a specialist, with your hematologist or whoever that you're seeing. talk about it and let them then plug in those, put you into the right place with the people, the experts in that area to deal with it. Because I think there's the awareness of yourself, because sometimes you just write it off as, oh, it's just one of those things, and without really knowing that it's actually an issue and it's been gnawing at you. You've had it for quite some time. So yeah, I think definitely more can be done, without a doubt.
Yeah. Okay. And Hannah, okay. Would you like to give it a try at this question? So I will ask it again. Yeah. So do you think enough attention is paid to your mental well-being and health when you are in the hospital? So when you go see your doctor, normally, obviously, you go through the normal, how you're doing, health-wise. But do you think that there is that focus? Would you like to see more of that? Can you tell us what your experience is?
Well, for when we're in emergency, there is activities we can do as well for our mental well-being that keep us occupied so that we're not just bored all the time. It would be nice to be able to just talk to other kids my age who have got sickle. Obviously, with the pandemic, it's a bit awkward to be in close proximity, but it would be nice to just share experiences with other people.
And with that, so do you also have these conversations with your doctor, for example, if you're not, feeling too well, and not just physically, but you maybe would like a bit more help to talk to someone to help deal, I know, obviously your support system is very important, but I think from what I gauge, from what Mila was saying, it would be nice for people to also be aware that there is mental health support available. I'm not, I think sometimes people aren't always aware that it is available. We just focus on making sure that our body is well, but obviously our body is also connected to our minds. And I think we probably want to see a bit more of that. I see some good progress personally in the setting, and I hope that it really carries on and that more families are aware that there is also help for them, in terms of dealing with the challenges of living with sickle cell disease, which are not just physical.
Well, yeah, I have been seeing people for it, my school wellbeing coordinator and my doctors, especially because it's not just physical well-being that I've been struggling with, it's mental, especially since my grandpa passed away, and just COVID in general. And I think it's hard for all kids not being able to see friends and go out, but it's extra risk for me, so I've got to take extra care.
It has been really lovely having you on. So I hope you enjoy the rest of the conference, and you keep participating. So thank you, and see you all soon again.